So, let's talk about the U.S. healthcare system. You could think of it as a patient, and honestly, it's not doing so well. It's suffering from some serious chronic conditions, like clinician burnout and just bloated bureaucracy. But there is hope. In this explainer, we're going to look at the symptoms, pinpoint the disease, and walk through a really powerful three-part treatment plan that brings together technology, strategy, and a total rebuilding of trust.
Okay, let's get right to the heart of the problem. For so many doctors and nurses, their daily reality has become this constant battle against paperwork. It pulls them away from the very reason they got into medicine in the first place, actually caring for patients.
This quote from Dr. Christine Sinsky really hits home, doesn't it? It perfectly captures the crisis. This isn't just about being annoyed with paperwork. It's a deep conflict with their whole mission. It's this daily disconnect between why they do the job and what the job actually makes them do. And let's put a number on that feeling. Get this. For every single hour a doctor spends face-to-face with a patient, they spend 2 hours on administrative work, updating electronic health records. 2 hours documenting for every 1 hour of care. That's not just inefficient, it's completely unsustainable.
This burden isn't just measured in wasted time and burnout. It has a staggering price tag. If we were going to give the system's main illness a name, it would be administrative complexity. And it's a condition that's both incredibly expensive and genuinely harmful.
Just think about this for a second. Nearly a third, about 30% of all healthcare spending in the United States goes to administrative costs. That's not money for medicine, or surgeries, or actual patient care. It's for paperwork, billing, and just managing the system. And a massive chunk of that is just pure waste. We are talking about $265 billion lost every single year on administrative tasks that do absolutely nothing to make patients better. Think about what that money could do. Fund research, hire thousands of nurses, and bring down costs for everyone.
Now let's zoom out and look at the global picture, because it gets even crazier. The U.S. spends more than double what other developed countries spend per person on healthcare. And what's the single biggest reason for that massive gap? You guessed it, our sky-high administrative costs.
And all of this circles right back to the human cost. That crushing administrative load is the #1 driver of clinician burnout. We've got over 60% of doctors reporting at least one symptom. It's a vicious cycle where the bureaucracy is literally burning out the very people we need to keep the system from falling apart.
Okay, so that's the diagnosis. How do we treat it? Well, part 1 of the treatment plan is a really targeted technological solution, using artificial intelligence to go right after the documentation problem. It's called ambient clinical intelligence. And the idea is actually pretty brilliant and simple. It's an AI tool that securely listens to the normal, natural conversation between a doctor and a patient, and it automatically drafts the clinical notes. This frees the doctor up to actually look at their patient instead of staring at a computer screen.
And listen, this isn't some far-off sci-fi dream. Health systems are already doing this, and they're using clear, secure steps to do it right. It all starts with patient consent, which is crucial. Then, they run a small pilot program to prove it works, they make sure privacy is locked down tight, and then they run it in a ghost mode to test its accuracy before it ever goes live.
So, does it work?
Oh yeah, the results are dramatic. A pilot study at Legacy Health showed that this AI tool cut the time clinicians spent on their notes by 40%. That is hours every single week given back to doctors, which means more time for patients and way less time charting late at night. But look, just throwing cool tech at the problem isn't the whole answer. Part 2 of the treatment plan is about the bigger picture, systemic strategies to heal the workforce and make the whole system stronger and more collaborative. One really powerful strategy is creating what are called communities of practice. Basically, they're these digital spaces where healthcare pros from different hospitals, even ones that compete with each other, can share what they've learned and solve problems together. It lets a great idea from one small clinic spread like wildfire and become a best practice for everybody, breaking down those old walls.
Another key strategy is just investing in the people you already have through upskilling. So instead of constantly trying to find new talent, health systems are building career pathways. They're training experienced medical assistants, for example, to become specialty nurses. This helps solve critical staffing shortages and gives their own employees a real path for career growth. It's a win-win.
And that brings us to the final and honestly, the most important piece of this entire puzzle. We can have the best technology in the world and the smartest strategies, but none of it works without a solid foundation of trust.
This leads us to a powerful new idea, the House of Trust. It's a framework for rebuilding healthcare organizations from the ground up. The whole point is to create a place where everyone involved, from the patient to the provider, feels safe, respected, and truly valued.
Now, every strong house needs a solid foundation, right? For this one, it's built on 4 core values: partnership, co-production, which is a cool way of saying that patients are actively involved in designing their own care, dignity, and respect. It's not about orders coming from the top, it's about seeing everyone as a true partner in healing.
And that foundation supports 4 essential pillars that hold the whole thing up: transparency in how decisions are made, clear communication, supportive leadership, and building true organizational resilience. These pillars are what turn those nice-sounding values into real, everyday actions. So, when you put it all together, you see the path forward. It's not about finding one single magic bullet. It's a combined therapy, using targeted tech like AI to ease the daily grind, using smarter strategies like collaboration and upskilling to strengthen the whole workforce, and, most importantly, rebuilding the entire system on a foundation of trust.
And you know, this combination is already starting to work. It's starting to heal our system. But the real work is just beginning. So the question for all of us is, how do we scale these amazing solutions and make sure that every single person, whether they're giving care or receiving it, has a secure and valued place inside this new house of trust?